techniques I need to show you today. The first thing you would need to be able to do if you were ever in a situation where someone was choking, regardless of their age, is you'd first of all need to be able to establish whether the blockage is what we call a mild blockage or a severe blockage, first of all. And each of them have different characteristics. A very good example of a mild blockage would be when a child or an adult eats or drinks too fast. It's the sort of situation where you get the big coughing fit, they go red in the face, it looks really serious. As a parent, I can imagine it's quite frightening. In reality though, if air can still pass out of that person's mouth for them to be able to cough, it can still be inhaled as well. What we do in that circumstance is pat that person on the back, right at the top of the back in between the shoulder blades. If they're old enough to do so, we're going to encourage coughing as well. And 9 times out of 10, that blockage is going to clear itself. Usually we don't have to worry further. When we do have to worry is when we've got what we call a severe blockage. That will mean we've got full covering of the person's airway here. And it will also mean that the person will be unable to breathe. Now the way you identify that in younger children, because they aren't able to necessarily state the fact that they're choking to you, is usually the child will appear like they're crying first of all. So you'll see a tearing of the child's eyes, their mouth may be open, but there'll be no sound coming out of the mouth at all. In an older child or an adult, they may be attempting to speak to you or trying to cough, but again, that's going to be ineffective. No sound coming out of the mouth at all, because air will not be able to pass over the voice box because of the blockage, okay? As soon as you've established that the person can't breathe, I would advise that you try and get an ambulance en route, okay? If there's someone else with you, give them the responsibility of calling. If you are on your own, I would recommend that you dial 999 and have them on speakerphone. Try and talk to them if you can whilst performing your technique. But it is better to have that as a backup, just in case the techniques I'm about to teach you don't work, especially given the response times that we talked about earlier, okay? Now I'm going to start with the infant technique first. So this technique is to be used on anyone under the age of 1 year old, okay? We've got a baby who's choking. We've established that the baby can't breathe. Okay, we've called the ambulance or we've got someone else to do that on our behalf. I've now picked baby up, I've turned them away from me like this, and I'm going to grab baby by the jawline here. I'm going to do that with my thumb and my pointer finger just underneath their ears here. What I then do if I was able to is I position baby down this same forearm by tilting them forward and positioning one arm and one leg either side of my forearm like this. Now I understand it can be quite difficult to position some infants down the forearm like this. Some 10, 11 months old, they can be quite big for their age. If you're struggling to fit them down the forearm, instead you would need to sit in a seat, a lower seat like you're all in now, and position them down your thigh in exactly the same way, making sure their chin is on the end of your knee. Either way, it is better to be seated to perform this technique so that you have your leg underneath you for leverage. So that you can all see though, I'm going to remain standing, okay? Once you've got baby positioned either down the arm or down the leg, what you also need to do is make sure they're in a slightly tilted position like this with their head towards the floor. Reason for that is we're going to try and use gravity to help us get this object out as well. If they were positioned down the leg, I'd achieve this by just straightening that leg out, okay? Once we've got them in this position, I'm then going to use the heel of my other hand here, and I'm going to perform 5 back slaps, right in between baby's shoulder blades here at the top of their back, okay? 1, 2, 3, 4, 5. That always sounds horrible on the plastic there and looks like some form of child abuse, but you have to be quite forceful when you do that, okay? You're hoping to create enough vibration in baby's body to hopefully dislodge the object in the airway. Okay, so as with the chest compressions, better to use too much force than not enough, okay? Once you perform the 5 back slaps there, it's important then that you check in the mouth to see if the object's present. The way I'm going to do that is to grab the back of baby's head with my other hand, and I'm going to roll them over very slowly. Again, this would be much easier to do if I was seated, because I'd have my legs underneath me for leverage, okay? Whilst baby's positioned on their side like this, I'm then going to check in the mouth to see if the object's there. It's important that you don't go from that position to that position to check in the mouth, which is sometimes instinct. But why wouldn't I do that? Straight back into the air. Okay, good. Just had to clarify. Really important that you do this check whilst they're on their side, okay? If I check in their mouth and I can see the object, it's positioned towards the front of baby's mouth and I think I can remove it, I'm going to take my little finger and I'm going to place it in and around the object to remove, okay? In and around, it's called a sweep, okay? If I check in the mouth, however, and I can't see the object, or I can, but it's positioned towards the back of baby's mouth, then in either of those cases, I would never risk putting my finger in there to try and get the object out. Why wouldn't I do that? Exactly right. It's a very small space in a baby's mouth. And if I can't hook my finger around that object, I am just going to end up pushing it further into their airway. So in either of those cases, I'm going to move on to the second part of this technique to try and clear that object, which is to perform chest thrusts now, okay? To perform chest thrusts, I'm going to need to take baby from the side position here, and I'm going to need to roll them onto their back. They would now be positioned on my other leg if I was seated. I still need them to be in the slightly tilted position with the head towards the floor, again, using gravity to help me out. Once I've got them in this position on my other leg, I'm going to take these two fingers, pointer finger and middle finger, and I'm going to place them right in the center of baby's chest here on the sternum, as I did before with the chest compressions. I'm going to push down, but instead of pushing straight down this time, I'm going to push in and up towards the chin. Slightly different movement with this, and I would only do this 5 times, okay? 1, 2, 3, 4, 5. You can see it's more of a wrist movement that I used with that technique. Once I've performed the 5 chest thrusts, again, I would need to check in the mouth to see if the object's there. I need to be careful that I don't lift baby up to do that, because again, the object has the potential to fall back into the airway. So I would need to keep them tilted to do this check. If I still couldn't see the object and I was hearing no sound, and I'd have to grab baby by the jawline again, roll them back onto my other leg, keeping them tilted, and perform those 5 back slaps again. 1, 2, 3, 4, 5. I'm then going to continue that. 5 back slaps to 5 chest thrusts, checking in the mouth after every set until the object is cleared, so it physically comes out of baby's mouth and they start to cough, cry and breathe again, or until baby starts to become uncomfortable.